What's up, everyone? Welcome back to Kind of Different. We've been off for a few weeks, and man, am I excited for this episode. It is going to be just an absolute banger. I am Matt Allen, CEO and co-founder of DifferentKind and host of Kind of Different. And I am super, super excited to chat with and learn today from some people who come from outside of the U.S. dental care system, who are doing some really innovative things, really thinking about care, potentially in really different ways than we are as we get stuck in our own country and our own ways of doing things. And so Catherine Rutland, who is the clinical director at SimplyHealth and Denplan, which is Denplan is part of SimplyHealth, at least that's my understanding, Catherine. And then Helen Goldsmith, who is a product manager and previously involved in kind of quality measures there and risk, at Denplan. So really just excited for both of you to join us today. Thank you so much for taking the time. And would love for you kind of both to just give us a quick intro to yourselves before we dive into some of the questions.
Yeah, it's great to be here, Matt. I'm really excited to kind of look at DifferentKind, and that's kind of how we met, wasn't it? We've started to kind of explore innovation in that dental space and how can we improve patient experiences, especially through kind of digital systems, which was kind of how we came to connect. Worked for Denplan in the dental space for kind of 17 years. Don't have a clinical background, but have spoken to lots of dentists and lots of patients through kind of research channels and just through connections. So yeah, it's great to be involved today and be here.
I love that. I do think that there's actually something really important about people who don't have a clinical background being involved in dentistry, right? It provides such a needed perspective. So absolutely love it. And thank you for joining us. Helen, Catherine, tell us a little bit more about yourself.
Yeah, great. So thank you, Matt. Thank you for inviting us on. As Helen said, really pleased to be here. A great opportunity. So I am a dentist by origin. I owned a practically all private practice for most of the time for almost 20 years. So have been through practice ownership. I did work in hospital for a couple of years when I first qualified as well, and then started working for Denplan almost 13 years ago. And my role has expanded and changed over that time. And now I lead on anything clinical, basically across all areas of the company. So it's been a real journey moving from clinical practice into the more, although the commercial world, obviously, of dentistry and dental practice, but into that wider, bigger commercial world of a larger company has been an interesting journey. But yeah, great to be here and be able to talk about it. And I think some of the differences between the States and the UK as to how dentistry works, so to speak.
Totally. Well, let's dive in then. Let's start in the kind of innovation space, and because I think that sometimes we think we're being really innovative here, and we may have missed something that's actually happening somewhere else that's really important. And so to kind of get to that area of what you are all focused on right now, we'd just love to start there. What is something that you're working on right now that's really exciting to you? That's kind of making you excited to get up in the morning. Would love to hear from both of you on that.
Okay. Lots of things, actually. We're in a really, really great place as a company. What we're doing at the moment is a lot of listening. We're always connected to customers, but we're really, really exploring kind of what are those pain points, where are those areas that we can really help our practices to supercharge their practices and deliver really kind of leading edge patient experiences. Have we sort of settled on one thing? We're exploring lots of different things. I think patient communication definitely comes out as somewhere where there's room for improvement, whether that be supporting the practitioner in a digital way. So can some of those communications be delivered digitally? Is that just something that can be offered in practice, whether it's videos, video explainers, that type of thing? So yeah, lots of different things, but yeah, quite centered around communication, I would say, at the moment.
I love that. Helen, you said something there that I think is really beautiful in terms of, we're focused on listening. And I think that if we're approaching, whether that's a patient or whether that is, a problem or, trying to improve, right, the quality of care and, helping and supporting the practitioners that are part of Denplan, right, to start with a listening posture. Oh, so very important. I absolutely love that. Catherine, what about you? What's something that you're super pumped about?
Yeah, I mean, I think for me, it's similar to what Helen's saying, but I think across the company, we're quite old company, if that makes sense. So Denplan in itself is 36 years old, but the SimplyHealth is 150 years old. So two big old companies that, yes, that brings lots of positivity and lots of knowledge and so on, but it's now we're really focusing on how do we move forwards, how do we turn that experience into positive, and from the innovative perspective, how do we move as the healthcare system in the UK is shifting so greatly. I think the pandemic, as everywhere, has almost not changed the direction but accelerated the direction in some areas, and so we as a company now need to be right, we need to keep up with that. How do we make sure that we listen on, as Helen says, in the Denplan side, very much to our practices or offices, as you call them, but on the SimplyHealth side, then how do we listen to the end consumer? What's going on, certainly with our situation here with the NHS and so on? How do we really do that? But also, what I find exciting, and I'm seeing more and more now, is how do we use the knowledge in both sides of the company to better provide services and plans or whatever it is for that end healthcare provision. And I think that for me is a significant shift we've taken in the last year or so, and it's more focused again in the last year or so, and I think that's a really positive thing. We're a purpose-driven organisation, we're a mutual, so we're not beholden to shareholders, so actually to have that sort of purpose of improving access to healthcare and then really starting to see a change about it is, it's very exciting.
That's amazing. I mean, let's dive into that piece of, some of the differences right there too in terms of innovation. Like, what's something that you feel like that, and let's just expand to the UK in general right now, what's some of the things that you've worked on in the past or that you've done or that you've seen even that you feel like, wow, the UK has gotten this really right when it comes to innovation, and here's how we've innovated that? And maybe what are some of the gaps where you're like, like because of the way our systems are structured or whatever it might be, here are some spaces where we may have struggled. I would love to just, kind of get some insight. And if you want to speak to one or the other or both, that's totally fine.
I think, I suppose for me, I've got a big bias in the sense that I think the capitative model that we have for Denplan has never really been reproduced particularly well around the world. And yet, when you look at so many of the areas of research, when people look at it from a completely objective perspective, capitation comes back and back and back. But actually, nobody really does it well, except for, I would say, we do. So I think that model that came in, as I say, 36 years ago, which was based around people being unhappy working in the health service, but from a dentist perspective and as a business owner, that real need to have that security of a returning patient base and a regular income, and therefore that lead into capitation, I think was a massive innovation that I think has not, and in fact, Helen and I were talking about it earlier, weren't we, around, or in the last few days, around as the rest of the UK healthcare model is changing, and we were saying dentistry that we're probably about 10 to 15 years ahead in the sense of that certainly that sort of private function, because of the strength of the NHS, is where can we use that knowledge that we have around capitation to benefit patients in other areas of healthcare and the other healthcare sectors of working as well, so that they, again, have the same concerns and same worries as dentists coming out the health service have here now. It's the same issue for any small business owner. It's the same issue. So how can we use that massive innovation into other areas, which is, is exciting. And I know I'm very biased, but I do.
Hey, I see it all the time in the US right now, right? We're talking about alternative payment models and value-based care, and you look at, Oregon moving their, kind of medicated, system to a fully capitated model, in dental even. And, that's this huge innovative thing. People are saying, wow, look at this. It's, and you guys have been doing it for a long time. So I think we have a lot to learn, from that innovation. And just because it's been around for a while, I don't think makes it any less innovative. And, to your point of, it still hasn't happened, right? And you're doing it well, which is amazing. So, Helen, tell us your perspective here.
Same, and like part of the conversation, or I've had conversations within the last 2 weeks of like other payment options and other payment. We're kind of always exploring kind of how do people want to pay for dental care, and we just come back to that kind of capitation model being so positive, because of course, another option is that you finance treatment, for example. You've got to go into a practice, you've got something that needs doing, but that's a really negative experience, because 6 months down the line, yes, you've had a root canal or whatever treatment it was you needed doing, and you're still paying for it in 6 months. Whereas the capitation model doesn't work like that. It's if you look at it, it's so much more positive because you're constantly kind of budgeting for a need that might occur. So it kind of it flips it on its head. I think I'd still say kind of the fundamentals, like Catherine said, that's our kind of biggest piece of innovation. What we're then looking at is, okay, what around that can we do to make that, I don't know, whether it's the patient journey in terms of their experience on a model or joining a practice, or how can we support a practice to make it easier to do business with us, all of those sorts of things. So it's not just about kind of innovating also in that digital space, it's also just innovative problem solving, and it could be something really, really small that in practice we've got the benefits of a big kind of corporate organisation with lots of brains and lots of different people and perspectives, whereas in an individual practice you don't have that. And I think we can't underestimate how something might seem really small to us, but we can support one of our member practices just with something that's just a different way to solve a problem that they've got day to day.
Yeah, and I think with that as well goes the prevention side of capitation from a clinical head perspective. Is, to me, certainly when I was in practice and owning a practice, that fact that people will come, we know from our research that people come more regularly if they're on a capitated product than they would if they were paying an individual fee for item. So that sort of regular care, certainly from a perio perspective, you know, that they'll come back, they'll see the hygienist because it's all there, and so that side of it is, I think, very much where we come from as well, is how can we really buy the patients into the model so that they are taking some responsibility for their own healthcare as well, because as we well know, clinicians, we can tell them something that then, but actually we're not there with them every time they brush their teeth or every time they eat or do whatever. So how do we make sure that we're encouraging that prevention side, and really keeping that focus for them, and then building those relationships so that they understand they have some control over their oral health. It's not well, we just go to them when we need it sorted out. It's their responsibility and they can do something about it. And I think that's as a clinician, certainly I've always found that really powerful.
Man, I mean, so much of this I think will resonate with so many leaders here in the US as well. And I'm just super excited to share this already, even though, you know, we're only a few minutes into the conversation here. So really, really excited to share because I think both of you have such a needed perspective in terms of where the US kind of healthcare system is going and what we can learn, you know, especially in dentistry. So absolutely love that. Let's learn a little bit more about the two of you. I've, you know, enjoyed our conversations, enjoyed, you know, getting to know you all a little bit more through LinkedIn and, you know, seeing some of the things that you all care about. One of the things that I would love to just, you know, have you share also, you know, in the same way that like, hey, what are you excited to be working on? Not just in a work sense here, but what's something that you're proud of that you would want to share with people? Something that you feel like, wow, you know, it could be work, it could be family, it could be whatever, right? But what's something that you're proud of that you feel like, wow, this is something that I've accomplished or done or, you know, been a part of that makes me happy?
I'll let Catherine go first.
I think for me, I think what I'm proud of is I had to completely pivot my career because I was really happy in clinical dentistry, in practice, loved it, would never have thought about leaving it, and then got hit by an autoimmune eye condition and was off work for 8 months. And that was really shocking almost. I was young, I was still in my 30s, you know, it was like, whoa, this can't be happening to me. And that reality check then to be able to pivot and turn, and I was then very shortly after given the opportunity to start working at Denplan, and it wasn't something I would have ever have gone and looked for. I don't think I would have necessarily thought I had the skill set to do it. So when I look then at the opportunity I've been given to go from that horrible place of thinking, oh my gosh, I'm never going to be able to treat patients again, I'm not going to be able to look after people, to changing my mindset to actually, but here in this role, I can potentially affect more change. And a different change doesn't mean one, it's just a different change. And so forging forwards and keeping going and learning more, went back and did my master's and in medical ethics and law, and then did risk management qualification, and then mentoring and coaching, and then building that, and then now doing like policy work, speaking with MPs around the role of mixed and private dentistry. That has been, for me, that's been massive, to be able to really expand that reach and with it take the company with it, and the pride of our teams, our internal teams, of what we do, and how we support practices, and really keep that going and take it into a wider space. I think that's probably something I would say I'm really proud of.
I love that. It speaks to such your continual learning mindset, I think, in that, right? And, some people get stuck, right, in those moments of I have to pivot or whatever, but I love that, the ability to just keep learning. And I get to see that at least a little bit from afar, right, of your ability to, have an impact with MPs and to be able to talk about those kinds of things. And, that's so interesting. And for the US listeners out there, right, an MP is similar to like a senator or House of Representatives person. You're kind of elected government official. Yes. No, totally. I know a ton about it because I follow a lot of UK soccer and, just always reading about that. And there's, reading UK newspapers and stuff like that. So, but just, for those who might not know, wanted to clarify that. Helen, tell us something that you're proud of that you want to share.
I guess sort of in a similar vein to Catherine, kind of career-wise, have always had always been interested in people and people's behaviour and and what drives behaviour, and come from a background of kind of whole of my kind of university studies was training to be a teacher, kind of looking at more child psychology side of things. But it wasn't the teaching that was as interesting. It was more kind of human behaviour and what drives human behaviour and how do you develop people. And I guess just being able to carry that through into a company who value that so much, I feel very grateful and quite proud to have been able to do that. And in many kinds of sort of leadership or management, been able to develop people into different career pathways when I've worked with the company, because it is something that's massively valued at SimplyHealth. Is kind of what drives people, how do we get the best kind of talent into the right places within the company and grow people within. So I think, so that's a big thing.
And she's right to be proud, Matt, because she is really good at
it. That's amazing. And obviously we need that so much in oral health, right? Just understanding of human behavior and whatever. But so much of company development and building great teams, right, is that piece that you're talking about of understanding what motivates people and, how to speak to each person individually. I mean, there's just so much there, Helen. I absolutely love that. And it's cool to hear your answer there to that question. Let's dive into making healthcare more human. Obviously, this is a global thing, right? It's not a UK or a US thing. We all want to see our healthcare professional, whether we're in Los Angeles or in London, right? We want to be able to see our healthcare professional and have them see us, hear us, understand us, listen to us. I think that the studies and the research show that consistently, that people want that from their healthcare experience. So thinking about that from, a perspective though of between our different, kind of countries, my perspective is that a lot of the kind of innovative work, in this space has actually been done in the UK. There's been, more, and maybe that's system-based, right, because of the capitated model that you're all talking about. But when you think about making healthcare more human, what's something that you feel like the UK has done really well? And what's something that maybe you look at the US and be like, oh yeah, we could incorporate that as well?
I mean, I think in the dentistry side, I think it's interesting, looking and researching for this around paternalism. I think actually in the dentistry side, we have shifted significantly away from paternalism, and it's and I think we're quite ahead of the game on that. I think we went through a very challenging time around a high rate of complaints, and consent was a big part and problem of that. And when people started to look at it, a lot of that was around the fact of not having those proper conversations at that consent point, and really involving the patient in their decision around treatment. And so, to be fair to the profession, huge change then, about 10 to 15 years ago. And obviously still always there's going to be tension there. But when you look at our regulator, the General Dental Council, that consent issue has definitely dropped off. You were seeing people at the regulator for consent. So I think that is something that you do see, and you see it as a change if we have dentists come in from who've graduated in other countries. You see it bumping up, because actually the patients have now, their expectation level is that they should have that level of communication. So if they see a healthcare professional who maybe just has come from a more paternalistic base, then it creates that rubbing. We see it through our services that we offer around sort of trying to support with complaints, for example, and try and solve them without it getting into a legal or regulatory perspective. And you can see this. So I think that's something that we have been very good. Now, that's in dentistry. I think medicine and the rest of healthcare is very much getting there as well. But I do think, because there is a relatively decent private base in the UK. There's now more private treatment than there is NHS treatment. Certainly, as I say, from a financial perspective, but that allows people time to have those conversations. So
Can I just dive a little bit deeper there, Catherine, and just ask a follow-up there? So you kind of mentioned this happened 10 to 15 years ago. Were there any kind of big themes running through, at that time, or like what helped facilitate that, right? Because that's a huge shift. What from your perspective was kind of some of the enabling factors that allowed that to happen?
Now I'm going to say something that people might shoot me for, but I remember when I qualified, it was still the point where we were less than half the year was female. And we used to joke, because certainly about 10 years down the line, we used to say we're changing the profession because we come at it from a very different perspective. And we now have more females every year coming out than males, and we just deal with things. No, but it's not a right or wrong. It's just the way we communicate is different. And I say it's a slightly controversial thing to say, but I do think that natural that females have to have more open conversation has potentially driven some of that change. So it's just like a natural shift.
Yeah, totally. Well,
because of privatisation and kind of what the capitation model does so fantastically is allow more time to be spent with patients. And I know from conversations we've had this week, and if I think back, my son's dental appointment last week, it was just so kind of person-centred. It was they had conversations that suited him. He was kind of, what's this bit for? Why is this light so bright? Do these glasses look cool on me? But there wasn't a kind of rush to get through all of that. He needed that as part of his appointment. So he's been through difficulties going to the dentist, through nervousness. So it was great that they could take that time to focus on him and his needs to get him comfortable to sit in the chair at that time.
Yeah, I think really that's such a good example, Helen. I think it is that, and people talk to each other, patients talk to each other. So it becomes a perpetual thing, doesn't it? If somebody starts to do it, then everybody else has got to start doing it. Otherwise, everybody else is going to go down the road to the practice down the road. So that natural competition drives change.
Yep. I love that. Man, yeah, such a great example. I mean, so yeah, I want to have this conversation for like 3 hours. But I just have one more question, because we always try to keep it like commute length, and who knows how long people's commutes are anymore with COVID and post-COVID and whatever. But anyways, we try to keep it, listenable for our viewers in one sitting. So we won't have this conversation for 3 hours today. But one of the things that I think is always really helpful, and especially probably helpful in your situation, given you're coming from a different system, is imagining ourselves as patients, right? Because we all are patients. We all, like Helen just mentioned, we have to take our kids there. We go there ourselves, whatever it might be. We take our parents there or whatever. So what's one thing that you feel like, and speak to dentistry specifically here if you can, but if not, feel free to, share from broader healthcare experiences. What's one thing that you feel like when you're a patient, something that does that a dental nurse, a dentist, a hygienist, whatever it might be, does that actually builds trust with you and actually helps you to have that kind of care experience? I think we heard something from Helen right there of, allowing that kind of time and kind of exploring that, whatever. Would love to just, hear a couple, other ideas there as well, because I think given what you're saying, we can probably learn, some things that might be systemic that we can adopt.
I think for me, it is that opportunity for conversation, and not being a clinician to be able to ask those questions around what does this mean, and also what does this mean after the appointment. So how am I going to feel? How long am I going to feel like that? It's those really human questions and that human conversation. For me, if that's not there, then yeah, there's not that opportunity to build trust.
Yeah, love that.
Yeah, I mean, I would echo that. I think I've been in situations myself. I'm not thinking from a dentistry perspective. It's always difficult when you're a dentist as a patient, isn't it? Because, you know, lots of the things that are of concern to patient, you know what's going on. So it's you know, you've already got that in your head. You know what's going to happen next. You know what's happening. But I've had a few situations where I had my left hand operated on many years ago. And as soon as and I'm left-handed, and I was still in clinical practice, so quite a significant op. And literally it was under general anaesthetic, and within about 24 hours or so, when I kind of looked under this massive bandage that I had going on, I thought, nothing's changed. Nothing's changed. I had this very weird kind of hematoma thing, and it was huge, and it was like, it's still there. So I rang in and said, I had it done privately actually, and I rang in and said, look, I'm really concerned because I'm looking at this and this literally, and I was just literally fobbed off of like, no, it'll just be this. So I thought, do you really think I'm that stupid? And needless to say, it wasn't. It was still there, and I ended up having to go back and have it operated again. But there was no acceptance from the surgeon that it was, you know, at that early stage, if there had been a completely different attitude at the early stage, and that really taught me when I was looking after my own patients of, got to take on board what they're saying, even if it's not necessarily something else, but you've got to make them feel like you're listening to them. You can't just dismiss it. It's so important that it's their health, their mouth, their whatever, and you've got to give them that opportunity to talk to you. So as Helen says, that time of them being allowed to explain, even if you have to explain why that isn't a problem or it isn't, you've got to allow them that.
Man, wow. So much goodness there. So much goodness. And one of the things that I think is relevant to, you know, the work that we're doing at DifferentKind is we see that after visit management, you both just spoke to, of what's going to happen after, and Catherine, like, hey, this is not what I expected, right? We see that as one of the biggest issues for patients. And I think even when we know that as clinicians, right, to be able to say, oh, this is what to expect and whatever, you can tell someone, hey, this is what might happen and here's what might, you know, whatever. But until you're living that moment, it's hard to know how you're going to handle that emotionally. You can understand it mentally, but it's hard to know how to process that emotionally, or you might have questions, or, you know, feel something that you want to express or whatever, right? And I think what you're both saying is the ability, even in those moments, to feel heard and listened to and validated and understood, and to know where to go and to call and to do all of this. It's just such a crucial piece in terms of what we see in the data of, hey, this is really crucial for patients. So really interesting stories
and
there.
Just to add to that, I think it's really important for us as clinicians to make sure we're not just listening to the clinical bit. I always say when I first started working for the company, I was in the privileged position of speaking, because this service we do with patient complaints, I was speaking to patients that weren't mine. So I had no emotional attachment from that perspective. I was listening to them, and they would have had a response potentially from a defence organisation that have had a good response, but it was all about the clinical. So they weren't happy, and you'd listen to them, and there was a whole load of other stuff around I couldn't book the appointment on time, or somebody was a bit abrupt with me, or this, that and the other. So no wonder us as dealing with a clinical complaint thinking it's this clinical bit, and they're not happy because actually you haven't solved or addressed or even said sorry for any of the stuff that is around it, and so they're never going to be satisfied. So you've really got to listen to all of it, all of the content. Not we as clinicians are terrible for just going, but it's all about teeth. No.
And it's obviously not, right? That's man. Again, thank you both so much for taking the time to join us today. I feel like I've learned so much from you in this conversation and through, you know, my interaction with both of you over, you know, getting to know you and interacting with you on LinkedIn. If people do want to connect with you or learn more about what you're doing at Denplan, or, you know, understand more about, you know, dental care in the UK or whatever it might be, you know, can you just give us some places where they could go to, you know, either connect with you or learn more? We'd love for you just to share, you know, hey, if listeners are interested in learning more, where would they go?
Yeah, I mean, certainly from my perspective, the best place probably is LinkedIn. Just send me a message. I think Helen's the same, aren't you? So that's probably the best. If you want general information, obviously the Denplan has a denplan.co.uk website. But as I say, if there's anything more specific that you'd love to learn from us, please do get in touch. We, as you can tell, very enthusiastic and passionate about what we do. We are only ever too happy to share it. So, yeah.
I love it. Well, thank you both again so very much. It has truly been just an honor to get to have this conversation with both of you today. Really appreciate it. Like I said, super excited to share it. And I know that all of our listeners will be much better for having heard it, and as am I. So thanks for taking the time again. Look forward to, maybe we can bring you back in another season. We can talk some more about these innovations that are currently happening, that maybe have been rolled out and that you've seen actually maybe have data on. Would love to continue the conversation moving forward. So thank you both for taking the time.
Thank you for having us.
Thanks for having us.